discussion because the numbers here in New York City are not just alarming, they're unacceptable. In our city, heart disease and stroke together account for nearly 1 in 4 premature deaths, meaning deaths before the age of 65. For Black New Yorkers, the burden is even heavier. More than 1 in 4 heart disease deaths among Black adults happens before age 65. And the Black adults in New York City are nearly twice as likely to die prematurely from heart disease as white adults. For Black women, the disparity is even more stark. Their premature heart disease death rate is more than double that of white women. These outcomes are not about personal failure, they are a result of cumulative exposure to inequity. From under resourced neighborhoods and limited access to preventative care, to food environments high in sodium and stressors tied to poverty and structural racism. Data shows New Yorkers living in very high poverty neighborhoods are more than twice as likely to die early from heart disease as those living in the wealthiest communities. And unfortunately, many of those neighborhoods look just like ours. I'm disheartened to report that the Rockaways, in particular, in the 31st Council District, are among the highest in premature heart death rates, along with Bed-Stuy, Crown Heights, and the Bronx. That is why conversations like this matter. Awareness saves lives, and early screening saves lives. Trust based care saves lives, and community centered solutions, of course, saves lives. So tonight is about shifting the trajectory from crisis to prevention, from disparity to dignity, and from silence to action. I want to extend my sincere thanks to our host, Ruby Mango, and our featured speaker, Dr. Daniel L. Beckles, for their leadership and expertise in this vital discussion, and especially to Horace for making this happen and having the vision and foresight on this topic. And everyone here tonight, your presence matters, your voice matters, and your health matters. Thank you so much for the partnership.
Thank you for that. Welcome, Ruby.
Thank you, Selvina. I co-sign everything you just said, and it's a pleasure to have you on. Thank you. I will go ahead and get started with my introduction, okay? So, good evening, everyone, and thank you for joining us for our health webinar presented by Caribbean American Association of New York, better known as CASONI, and Trinbago Progressive Association of the USA. Okay, I'd like to begin, I guess, by sharing a little bit about how this webinar series came about. I try to do this each webinar series because we have new folks that may not know the background. Okay, so the idea was sparked through conversations between Dr. Daniel Beckles, whom you'll hear from shortly, and Mr. Horace Davis, founder of CASONI. So together they envisioned a free public webinar series designed to strengthen our community's health literacy, promote self-advocacy, and help dispel long-standing misconceptions about important health issues, especially pertaining to Black and Caribbean community or the diaspora. Okay, Dr. Beckles has prepared a brief presentation for everyone tonight. We kindly ask that you hold your questions until the end so we can have a productive and focused discussion at the end. And with that, it's my pleasure to introduce Dr. Daniel Beckles. So I'll tell you a little bit about him, okay? Dr. Beckles is a Trinidadian-born heart surgeon with over 3 decades of clinical expertise in cardiovascular disease, education, and research. He is the Chief Medical Officer of Trinbago Progressive Association and has teamed up with CASONI, as mentioned previously, to bring clarity, awareness, and knowledge on some very important health conditions. Dr. Beckles is a highly respected cardiothoracic surgeon, and we're truly fortunate to have him with us here tonight for this discussion and engaging conversation afterwards. Okay. I think I covered everything about Dr. Beckles. I could go on for another 45 minutes, but I think that's my time. So without further ado, I'll pass it over to Dr. Beckles.
Thank you, everyone. Thank you for that gracious introduction. Thanks for our sponsor, Selvina. Thank you so much. Yes, you could have actually given half my talk with all those numbers and statistics. So that's why we're here, right? So February is a very busy month as we start the year off strong. And this talk is about survival. It's about, longevity. It's about ownership of health. Black and Caribbean populations have extraordinary resilience, but disproportionate cardiovascular risk, as was just highlighted by our councilwoman. Hypertension is the single most powerful modifier driver of early heart disease. We're going to take just one tonight. If you go back and look at our webinars, we talk about diabetes, we talk about high cholesterol, we talk about obesity. Today, we're just going to super focus, deep dive mode into hypertension and get rid of some of those myths that we may have. The good news is most of this is preventable. It's preventable. We have leaders on this call that can go out, start with their own families, start with yourself, and let it ripple throughout the rest of community where you work, where you pray, where you meet, where you eat, and let this word get out there to help other lives in the communities that really need it. So let's move on and get this talk started. These are my disclosures, just that I'm an academically affiliated surgeon and in active practice. So why this talk and why now? Well, heart disease, just heart disease itself, remains the #1 killer of men, women, Black men, Black women, worldwide, young and old, right? Caribbean nations mirror, and in some cases even exceed the US rates of uncontrolled blood pressure and diabetes. This is not a genetic problem, as was mentioned before. This is systems, education, access, follow through problem, right? And that means it is solvable. We can put a man on the moon, right? We can solve this. We can do this. This is all preventable. So the agenda today is listed here. We will start with data, hard data, facts, not opinions. And then we will dismantle some common myth that quietly sabotage our health decisions. And finally, we will end with practical framework that you can use immediately this year, this month, this week, tonight, on getting your health on track. So heart disease is a global killer, all right? No one is immune to it, all right? We are all at risk. And as you can see here, hypertension affects 50% of adults. So 1 in 2, right? Look around on this chart, 50% of us may have high blood pressure. Blacks, adults develop hypertension earlier, and even worse complications. I've learned that the hard way. I didn't realize that we can get high blood pressure at age 20, as early as age 20. Imagine that, right? And so that's why we always scratch our heads and say, how come somebody's coming in for open heart surgery at age 40? How is that possible? Well, the disease didn't start at age 40. It started decades before, and it's no longer known as an elderly risk factor. Worse outcomes at younger ages, as we can imagine. So Black adults develop hypertension 5 to 10 years earlier than white counterparts, and they experience more severe complications, and we're going to go over that. Early onset means longer exposure to that damage. Damages the brain, the heart, the kidneys, and blood vessels. So let's ask a question. How many people die anyway let's start with heart disease. So according to the world in data, cardiovascular diseases in 2021 globally killed 20 million people. And high blood pressure killed 10 million people. So just think about that for a second. Let those numbers stick. 20 million died of cardiovascular disease. And when we say cardiovascular, we mean stroke, and we mean all the other heart diseases. When we talk about risk factors, and I'm only going to focus on one, hypertension is 10 million people died. Now, I'm going to draw even a bigger comparison. When COVID hit in 2020, and as New Yorkers, we know what that meant. Well, from 2020 to 2024, 7 million total people died globally of COVID-19. But when we look at just 1 year, 20 million people died of cardiovascular disease. That same time period, in 4 years, 80 million people died of cardiovascular disease. Yet everybody lined up to go and get screened to see if they had COVID-19. The biggest problem here is people are not going and lining up to go and get screened for a bigger killer than COVID-19, which is high blood pressure. And that's what this talk is about. You should have had your blood pressure checked and know your numbers and know what to do next if it is not normal. So let's dismantle this. what is high blood pressure anyway? What does it mean? I mean, what is it really all about? Well, they keep changing the criteria. And so it used to be 140. If you heard the top number, as you can see here, 120 over 80, that top number, if that number was 140, it used to be back in, 2017, that was the definition of high blood pressure. But today, that number has actually come down quite a bit, and it's actually may even go lower. And so the new current definitions, normal is 120 on that top number. So if you're above 120, that is called elevated blood pressure. And if you go above 139, and if you're in that 140 range, that is now called stage 1 of hypertension. And everything I discuss moving forward in these slides, when I say high blood pressure and all of the statistics, it refers to having a number 130 and above. But just remember, 120 is normal. That's your goal, is to try and get it down to that number. So what are the consequences anyway? The consequences of years and years and decades of blood pressure being high leads to what? We talk about mortality and death. Yes, it causes strokes. 77% of people having a stroke have high blood pressure. It's hard to have a stroke without a high blood pressure. Heart failure, the heart fails over time. Why would the heart fail over time? We're going to get into that. Erectile dysfunction, sure. Kidney dysfunction, the second leading cause of why those dialysis units are going up everywhere that you see is because of high blood pressure after decades and decades of destruction that kills the kidney. It kills organs one by one. Vision loss, and of course, heart attack, heart disease. It's a major risk factor for heart disease, and why I operate on patients' heart all the time. Now, I want to introduce you to an incredible organ, my favorite organ. It's called the heart. It's a pump, okay? And so this is the muscle that really pumps blood. And think about it for a second. 70 times per minute, the heart pumps the blood. And it's a muscle. So it's made out of a muscle, but yet it never cries and say, I'm tired. Even while you're sleeping, it's still pumping blood while you're sleeping, okay? And it pumps 100,000 times a day. Think about that for a second. Think about doing 100,000, anything. The heart muscle pumps all the way through in your lifetime, 3 billion times in your lifetime on average for someone living to 70 years old. So the muscle has the blood and it pumps it through blood vessels. Just remember, it's like plumbing. And so it has to go through every organ from head to toe to keep your toes warm and to get blood to your brain. So that's what we're talking about now. Imagine that this pump is under higher pressure. That is the problem. We were not created to be under a high pressure system. If you had a high pressure system in your car, it would have a gauge. It would say, oh, the engine is, overheating, right? Well, we're not connected to any gauges. So we have to be empowered to go and get checked to know what is our number? What is our blood pressure doing? When we look at the human body and all the little vessels, this is a hand, of course, and you can see all the blood vessels. And so you can see this in the museum. You can go to the museums and see these sort of sculptures this is what the blood vessels we're talking about. We're very delicate blood vessels. We were not created to have blood pressure above 120 millimeters of mercury. When we go above that, that's when the destruction happens over time. And so that's bringing a little bit of anatomy to you. And sorry for that. Okay. Let's go into who. So who actually gets high blood pressure, right? And so 50-50 speaking, we said 50% of people on this call, right? Because that's statistically speaking. But when you look at the data shows that percent of the population, males 20 to 34 years old. Think about that for a second. We used to think that high blood pressure is an elderly population. Yes, one gets a high blood pressure as one gets older, no doubt. But 25% of males have high blood pressure between the ages of 20 and 34. This is when we're in college still, we're going into professional school. We're focused on other things. We're focused on grades. We're not focused on blood pressure issues. Okay, and so that's the problem right there. In females, 13%. And we can see it does increase over time. This even up to 2025 is again the same thing. 18 to 34 years old, we're still seeing 4.1% blood pressure. 35 to 49, still 15%. And in 50 to 64, we see 37% high blood pressure range. Again, all the data, all the statistics, all the studies done so far looking at blood pressure in men, we can see the age group of 18 to 39, 31% have high blood pressure. And in this tender age group, 40 to 59, where we're all working adults and we're focused on family and business and jobs, this is what we have blinders on. These are our blind spots. And we'll get into why. So when we look at blacks compared to whites, you can see almost 60% of males and blacks have high blood pressure compared to our counterpart whites, 47%. When you look at the gap, same thing in females as was highlighted by our councilwoman. 56% women have high blood pressure and 39% are whites. So you see the huge gap is in females or black females. They have the largest gap in terms of high blood pressure. They should be the ones getting screened. When we look at the incidence of stroke, look at this incidence. It's pretty high. It's almost double in black young adults. And I only pulled the numbers for ages 20 to 44. Ages 20 to 44. I know our consumer talk about 65 years old. This is happening younger than we thought. This is young people in their 30s and 40s having strokes and dying. Heart attacks in that same age group compared to whites. And we can see that the mortality for heart failure and admissions to the hospital is almost double. So we do have a huge problem in disparity in care and in cardiovascular deaths. And when we're just talking about high blood pressure alone. So why? I mean, you have blood pressure high. Okay, so what? But why do we die from it, right? Why? It's because the vessels were not created to have a high blood pressure in it, as I just showed you. It's doing its job, pumping the blood throughout your body, but it should not be in a high pressure system. And the human body, we don't have gauges like a car that's going to tell us, oh, it's overheating, or you need to slow down, or you have too much stress, or you took in too much salt, or you didn't get your daily amount of fruits and vegetables today, right? So we don't have any gauges. And so this is why high blood pressure is considered what's called a silent killer. It's exactly that. Great demonstration on this chart. Thank you. It's silent. So think about blood pressure like a check your engine light for your body. Just as we won't drive a car, right, for years without even knowing what our pressure in our engine is doing, we should not continue until we find out what is our blood pressure doing. Okay, that's as simple as that, right? We don't check to see if we don't check to see if we have high blood pressure. People were lined up, like I mentioned before, to get their COVID-19 test to see if they were positive. Well, this should be a priority for sure since COVID is over. So I believe home monitors matters. And you can see here I said home monitors matters. And what does that mean? For about $40 to $50, you can get a home monitor. When we think about it, we have all these things in our kitchen. We have a toaster, we have a blender, we have vacuums for every part of our house. We have, you name it. We have all these special mops that we have to read directions how to use, right? Think about it, to clean our floors. We have all these devices. We have a waffle maker, right? Air fryer, right? Toolkits. We even have a flashlight that costs more than $50. And the reason why I'm mentioning that is that when we do the math, the cost of having a complication of high blood pressure is in the thousands, up to $7,000 to go to the emergency room if you have a stroke. When you compare that to the cost of getting a blood pressure machine in your house, and not just for you, but for the entire family could check their blood pressure at every single age, you actually make money over 20 years lifespan of having that blood pressure machine. So I want you to think about that. That is huge in terms of investment in your life, in your family, and in everybody around you. So hypertension doesn't announce itself, right? Many people feel fine while their organs are being injured and destroyed every second of every day, even while they're sleeping. By the time symptoms appear, the damage is already advanced, right? So that's why numbers do matter. How you feel doesn't really matter because that's why it's known as typically the silent killer. The problem, a single reading, people say, okay, I went to the doctor and I had my readings checked, right? One reading in time Think about that. Your car engine doesn't just come on and tell you one reading in time, right? Continuous is always better. Today, we're living in the best time in history where we have all the technology that's so cheap, that reasonably priced, that you could get this anywhere in a pharmacy. So I would say the solution to that is to get a machine and to get your blood pressure checked many times during the day to make sure that it's not falsely negative or falsely positive. Get yourself in a comfortable place and know really what your blood pressure is doing. Really get to know your own heart and your whole cardiovascular system, because it's the number one reason why anyone on this chat will die is because of heart disease. So just remember that up to 20% of adults have masked hypertension. Sometimes when you see this white coat I have on, you're like, oh, your pressure goes up. But some people it goes down, right? So everybody's different. So it could be a false reading you're getting in your doctor's office. So there are multiple risk factors to having a heart attack and stroke. It's treatable, but so often it's untreatable, and that's why it will still remain the number one killer. All right, so let's talk about our New York data. I think did a great job at those numbers. There's a high hypertension prevalence, poor control despite treatment. What does that mean? It means that people are aware, people are on medications, and yet still they're not controlled. There's a high emergency room visits and hospitalization. Black adults exceed 55% of prevalence of high blood pressure. And yes, it has to do with socioeconomic stresses. When we look at these numbers, we talk about percent of the population in this age group. 25% of males have high blood pressure, and 13% of females. When we look at non-Hispanic whites and we look at non-Hispanic blacks, you can see here that, okay, almost the same amount are aware of high blood pressure. So having awareness is one thing. Treatment is about 50% are treated. And half of that number is actually under control. So it's like taking the medication and still not being controlled, right? That's not winning the game. That's not being successful. Okay. Success is getting it under control, repeating your blood pressure, going back to your doctor every 3 months, getting your blood pressure medications titrated until it gets under better control. We see the same numbers with diabetes. Okay. Awareness, treatment, and uncontrolled. So it's a very inefficient system, but you have to be an advocate in your health. Across the Caribbean, we also see the same sort of trend. We see hypertension, we see diabetes and obesity rising. We see lower screening rates. At least we have the technology to screen here in the United States. Almost every insurance, no matter what insurance you have, if you don't even have insurance, you could still get a free blood pressure screen somewhere. In the Caribbean, we're trying to push for that, but it's not happening yet. So later presentation. Let's look at this study. We see here global, regional, and national comparative risk assessment. This is Lancet, 2016, looking at global burden, of disease. And you can see here for the Caribbean, you can see all the islands here. I highlighted Guyana, but there's Trinidad, there's Jamaica, there's most, representation here. And you can see that high blood pressure in red is the leading risk factor for why people die in the Caribbean. So still in the Caribbean, just like I showed you globally, number one. But you can see here, breaking through are some fasting glucose. So diabetes in Jamaica, diabetes in Trinidad, these diabetes seems to be taken over, and a little bit of obesity, as you can see in yellow. So we have this sort of trifecta where we have high blood pressure, we have diabetes, and we have obesity kicking in all at the same time. Okay, and that spells disaster. Having one is enough. Having 2, 3, it works to add more stressors to our cardiovascular system. Again, to highlight, New York, versus the Caribbean. Again, we mentioned this poor control despite treatment is key to understand on this chat. Not because somebody's getting treatment. Oh yeah, I'm taking medications. Yeah, sure. That's still inadequate. We have to be under control. Taking medication is the first step in the right direction, but getting follow-up and follow through and being persistent is the other one. All right, men and women are different. I always tell my patients, women are wired differently from a man. All right, no doubt about that, right, Ruby? So men have earlier disease. Men, unfortunately, very stubborn. Very stubborn. They avoid even getting checked for anything. I had webinars, I showed up in person to men's talk, and not one single man showed up to the talk. There were 50 women showed up, but no men showed up to a men's talk. Think about that, right? So it's very hard to get our own people into listening or being aware of their health. They think they know it all. And it's unfortunate, very unfortunate. It costs their lives. Unless it's mandatory, unless we make it part of jobs and make it mandatory from policy making, it's unfortunately a very tough problem we have. But awareness is key. Women underdiagnosed all the time because women have different symptoms of heart disease. They don't have the same crushing chest pain. They may say, I'm not feeling well. They may say, I have dizziness. It's just very vague. They just don't have the same problem in terms of presentation. So it makes it very complicated to make the diagnosis. And that's why it's very important to just know your numbers, know if it's going up, know if it's in a normal range. So then if you feel fatigued, you know it's not your heart, because if your numbers are in check, then you should be okay. All right, so let's go over some myth busters. High blood pressure runs in my family, so there's nothing I can do about it. Well, okay. Again, today we have the technology to fix almost everything. All right, so knowing what your numbers are and starting that regimen, we have all the technology, I believe, to correct every single risk factor. And you'll see what I mean by that. Genetics does increase the risk, but lifestyle determines the outcome. Okay, and so they say genetics, can, set the gun, but lifestyle pulls the trigger. I feel fine. If my blood pressure were high, I would know it. Well, I just told you, it's a silent, you have no symptoms at all. All right, 50% of you have high blood pressure and you don't even know it because you're not going to know it. Only older people get high blood pressure. I just showed you. You better get it out of your head. Younger people, your kids, your grandkids can have high blood pressure already. All right, one machine in the household can save a life and leave a legacy. It's just stress. Once things calm down, my pressure will be normal, right? Well, stress does raise blood pressure, and that's why it's important for you to have a monitor so you can monitor it continuously at home at different times in the day and when you're relaxing, so you can get the real sense, not when you're hustling to find some sort of car park to run into the doctor's office and then you drank your coffee already and then your blood pressure is higher than normal, right? And then you see the white coat syndrome, right? All those things kick in. No, get a machine. Keep a good tab, keep a good log of your blood pressure. Take it to your doctor and show him what you are during all different times of the day. It means that you care about your health and he would care more about your health. If I take medication, that means I failed. Absolutely not. Medication is prevention. It's not failure. It lowers the risk and it actually extends life. Getting that pressure down, the heart's beating 70 times a minute, right? You have to get that pressure down. Wait until lifestyle kicks in. You can always stop the blood pressure later on. I'm skinny, so I can't have high blood pressure or metabolic issues. Well, you can be thin and metabolically unhealthy. Unfortunately, that's called the metabolic syndrome. Okay, and I think more people die from that myth than anything else, unfortunately. Salt is the only problem. Well, no. Guess what? You add sugar to that, you add all the sugary drinks, you add processed foods, you add lack of sleep, you add a little bit of overweight, you add, inactivity. Guess what? You just added more to it. It's not just salt. It's multifactorial. If I take medication, that means I fail. I think I mentioned that pregnancy-related high blood pressure goes away, so it doesn't matter. Well, guess what? If you had high blood pressure called preeclampsia during your pregnancy, you're at a higher risk of having cardiovascular complications later on. You need to go and get follow-up of your blood pressure more than anybody else. Okay, so not because it's after your pregnancy. So these are part of your history that you need to let your doctors know. Heart disease affects men more than women? Nope. Heart disease is the leading cause of death in both men and women. No one is immune to it. When we look at the risk factors out there, I think this number is now 7. It's increasing all the time. So there's 7 out of 10 Americans that have at least one risk factor. I think the new number is 5. 5 out of 10 have 2 risk factors. All right. So we have a problem, as was just highlighted. And it's So simple. I made this framework. This framework has been put out there. ABC, you couldn't get more simple than this. If you could just focus on your ABCs before I operate on anybody, I need to know what their ABCs are before I take them and try and fix their heart. Because if I fix their heart and these are not fixed, it's like, why am I wasting my time? Right? So as a surgeon, we have to know what people are doing before so that we can give them a good prognosis afterwards. So the framework is A is for A1C, right? Glucose, diabetes. B is for blood pressure. And all of the talk so far, this is the framework we use. And today we're highlighting just blood pressure. The goal and the challenge I leave with you for 2026, you have the ability to get rid of all your risk factors. I've seen patients do it. I've seen everyone, if they just follow up with your doctor and let them know, use this framework, knowing your ABCs, that's what you ask your doctor for. I want to know what my ABCs are. He will know exactly what you mean. A is for A1C. There is normal. There is pre-diabetes. This is the phase that you can reverse diabetes before it gets into the diabetes phase. And sure, if it's in the diabetes phase, you may have to take some medications until you do some lifestyle changes, small little changes. You'll be surprised. Can get you right back to normal in no time. All right, focus on that. We talked about blood pressure, okay, and home monitoring, how it's critical to get your own machine at home, and consistency over intensity, not just once a year at your doctor's office. Check it a couple times. Trust me, your heart will love you for it. Cholesterol, we find that it's 1 in 300 people could have hypercholesterolemia. This is pretty high in the general population. And so it's very important to get your numbers checked. It's a blood test, unfortunately, but this is the plaque that builds up over time. And again, it can be high in people at age 20 years old. And that's what starts with, you have high blood pressure, you have a little bit of cholesterol going on, you have a little bit of diabetes, pre-diabetes going on, all three factors going on. That's where we get into trouble. We start getting plaque deposited inside the vessels, and it causes strokes. It causes heart attack prematurely, premature death that was just mentioned. Okay, statin saves lives until you get your lifestyle in order. So here's another myth. I need to exercise real hard. I need to join a gym, right? You hear about the gym stuff, right? But guess what? Losing a little bit of weight is 80% nutrition. Okay, 20% is movement. But you just need to be consistent. Walking is very powerful. I love New York City because you can walk for blocks and really get your steps in, right? Easily. But it's what we eat is what counts to lose weight. So walking is very powerful. Keep the consistency of walking. Food choices does matter most. And it isn't, you don't need high intensity. You don't go to no gym and do all kind of crazy workout. What about diet? So salt and sugar are well known to be detrimental to our health. Just by cutting back on salt, eating more whole foods. Again, cultural foods, we just have to upgrade it, not eliminate it, just upgrade it. Okay, there are different ways to make food taste great with spices, and watch your portions. Let's look at this study. This is the health effect on 195 countries in 2017, also looking at global burden of disease study. And they look at why did 11 million people die, and they asked the family the question, what was their nutrition made of? What did they eat and drink? That's all they ask in a questionnaire. And what turns out to be number one on that list? A diet high in sodium. Salt. That's it. Too much salt. The other 5 reasons why they die in terms of nutrition is what was lacking. So we're not telling you to go and starve yourself. We're telling you to go eat more grains, fruits, vegetables, seeds, and nuts. Go eat more of those, and that is what these people died of. When we look at the scientific state-of-the-art review, salt reduction, in the JACC Journal 2020, you can see salt intake has been associated with raised blood pressure, blood vessel damage, hormonal pathway damage, inflammatory cascade, gut microbiome damage, all of these things leading to multi-organ, brain damage, cardiac damage, kidney, multi-organ failure and damage, right? Leading to death and burden of disease. All the studies, all the meta-analysis from since 1986 to 2017, all of the meta-analysis in people who have reduced taking salt have shown a decrease in blood pressure in every study on every continent. So just by cutting back on salt, The problem we have is that most of the salt comes from restaurant foods. Remember, the competition between one oxtail tasting good, one oxtail dinner tasting good down the street, and one tasting better up the street is more salt. Just add more salt, and that's how you win the customer. So their competition shouldn't be your life in the middle. So don't get faked out. That taste from restaurants, just be careful. You can cook your own food and reduce salt in that food. 11% is table salt. 14% comes from food naturally have salt in it. So just have to watch your salt. We take too much salt in, and the daily recommended amount of salt, yes, I know this is a screamer, 1 teaspoon in 24 hours. That's how much sodium we need to take. So again, that's how our body was created to take. And that's why high blood pressure is the leading cause of death on planet Earth. But we have to be aware that salt is detrimental. This is what a plate should look like, as you know, half plants and the other half grains and the other half healthy proteins. You can go on myplate.gov to get more, make a grocery list. You could do some food swaps. I talk about this in January, switch from fried to bake, macaroni cheese to roasted vegetables, soda to water, and start getting into grains, brown rice instead of white rice. When you look at all the diets out there, all the studies over the last 3 decades, the Mediterranean diet stands out to be number 1 in terms of cardiovascular fitness, in terms of mortality, and in terms of health. Mediterranean diet is full of grains. They have this diet called the DASH diet. That means dietary approaches to stop hypertension, developed in the United States. And so you can see here, all you have to do is one thing at a time. If you cut out one thing at a time, cut out some salt, cut out some sweets, cut out the sugar beverage, switch to water, some sort of fruit juice, cut out some dairy, and bulk up on this side. Eat this and not that. Very simple. Mediterranean diet is full of whole grains at the bottom of the pyramid, then fruits and vegetables. And yes, there is some red wine in there. So, there is some hope. Some physical, activity, but you can see on top here, monthly, they eat red meat, right? And so weekly, they eat eggs and sweets and, poultry and fish, but daily fruits and vegetables and grain, daily is the Mediterranean diet, just to show you. But if you look at the Caribbean, we're full of it. We got tons of vegetables, right, to choose from, tons of fruits. So I don't think there's any lacking fruits and vegetables. So we have to eat more of our own Caribbean food for sure. Fruits of color. Just load up when you go to the grocery store of foods of color, because that's really where the nutrition and the phytonutrients come in from. So the Caribbean does have a weight loss advantage. Home cooked foods are great tasting and they're healthier. Ground provisions are better than all the other carbs out there. You got fish, right? A good fish soup, right? Fish and plant-based traditions, right? Family support. You got movement, right? Right now it's like Mardi Gras. I think it's like Carnival time in Trinidad, right? You have family support. Accountability is very powerful. And just try and add vegetables to every plate, whether it's carrots, cucumber. Just try and add some vegetables to every plate. But you also have to remember it's also multifactorial. You got to eat earlier, sleep better, and you'll weigh less. So exercise, I went through the A, B, C, D. Now I'm on E for exercise. I think it's very easy to get 30 minutes, a day, to get 150 minutes in per week. Just stay consistent. Stay consistent. Walking counts. You don't have to go to a gym to do things. When we look at physical activity and the benefits, it's like the best medicine out there, right? It lowers all-cause mortality, lowers the risk of high blood pressure, lowers the risk of diabetes, it lowers the risk of having a high cholesterol level. It improves sleep. It improves, depression, anxiety. Look at this list. It's like, this is the best medicine ever, right? We were created to move more. Just remember that. Moving more, have a lower mortality, and this is what's recommended, 150 minutes per week. Sitting is now the new smoking. So try and get up and move around more, not sit around. And stay active. There's so many ways. Grab a ball, go outside, not now in the winter, but when things warm up there. Just get out up there and just go walking. Go in the mall and walk. This is what I was talking about, metabolic syndrome. These will be the last few slides. Metabolic syndrome is a cluster. It's a cluster that can fake us out. All right. It's 5 things. And all you have to have is 3 of those 5. And so one of them is having that sort of waist circumference. Just by putting a tape measure around your waist, and seeing if you have a big belly, that could be one factor. But knowing your triglycerides, knowing your HDL, knowing your high blood pressure, and if you're a diabetic, these are the 5 things. And you can have any 3 of these 5. So most people, if they're skinny, they can have high glucose. They could be a diabetic and not know it. They could have high blood pressure and not know it. And their cholesterol could be high and they not know it. So those 3 things go ignored for many years, can end up like this. Normal weight, but they have metabolic syndrome. Normal weight, metabolic syndrome, highest mortality. Okay, that's the problem. At least if you have some obesity, then you go get screened and get checked because it shows on the outside. But for skinny people, you need to be aware that you need to get your numbers checked even more so than somebody who is a little bit overweight. All right, I'm afraid so. All right, screenings. I talk about screenings. The S, A, B, C, D, E, S. This is the last one. Well, screenings is knowing your ABCs, but it's also cancer screening. Today, we have the technology for less than $100. You can go and get a calcium score to know if you have calcium buildup in your arteries and if you're going to get a heart attack or not. So you can go and get these things done. You can get your colonoscopy done. That'll be next month's talk on colon cancer, which is the leading cause of cancer in people under 50 years old. And screening also have to do with, like I said, getting a calcium score on the ABCs. All right, this is Life Essential 8, and I just discussed the 3 things here. A is for A1C, getting your finger sticks checked. Your blood pressure, B. C is for, cholesterol. D was for diet. E is for exercise. You don't need to join a gym, right? Stopping smoking, getting some sleep, and watching your weight. These are Life Essential 80 by the American Heart Association. Nothing new. So your heart plan, what I'm going to hold you to is know your numbers. If I call you out, you should say my A1C is, my blood pressure is, and my cholesterol is. Track it. If it's abnormal, check it again in 3 months. Go back to your doctor and say it was abnormal. I did some changes. Check it again. I'm sure it's better, right? Take proactive stance in your health. It's worth it. So become the person as identity who knows their blood pressure for himself, for herself, for your family. Be the person who tracks your numbers. Be the person who eats healthier, eats earlier, walk daily. Be the person. Become that person. Make it your identity that I will do this. Prevention is real power. Knowledge is protection, and action saves lives. So heart health is legacy, and thank you very much. And we'll take questions now.
Thank you so very much, Dr. Beckles, for another very, very informative presentation. I think I'm learning just as much as anyone else on this series tonight about heart health. So we appreciate you.
Well, I'm actually learning too as I look up these topics and see how alarming the numbers are, the disparities are. I wasn't even aware it was that bad. We're in trouble.
Yeah, it's very alarming. And just, as you were talking about sodium, I thought all the different ways that sodium sneaks into our diet. We think, add in salt or, sea salt, whatever the case may be, just, to get your daily iodine. But we're doing a little bit more than we need to.
A little bit more, yeah, like 10 times more.
Yeah. Especially with the fast foods and canned foods and so on and so forth.
Right, but now there are alternatives. There are no salt alternatives. There's a new brand of no sodium canned foods, a new technology that came out to have all the beans and stuff be with zero salt, zero sodium. So they're finally, like I said, we're living in a great time in history. We have the technology now to do massive vacuum sealing of these foods without pounding it with sodium and preservatives as they used to before, because people are aware now of what the number one killer is. The word is getting out slowly but surely.
Very good. Thank you. Thank you all so much for staying with us for the duration of our talk tonight. I would like to open the floor to questions. If you have any, please feel free to raise your hand, use the little emoji there, and we'll try to get to as many as we can. We do have one in the chat, and that one in particular came in a little bit earlier from Allison, I believe, and she wanted to know, how could she possibly make an appointment with you?
The goal is, convenience. Convenience. You can make an appointment with me virtually. I can see you virtual. I'm part of Oshna Health. and I can put the information on the chat. But you can go locally to get your numbers checked, get screened. A lot of people want to come all the way where I am in Texas, but you don't have to. It's all local. New York have a lot of resources locally. If there's something more advanced, I've worked in New York City. I've been in Mount Sinai in New York City. I've been, so I've worked in every place, and I know people everywhere. So I can connect you to good doctors there who can take good care of you.
Very good. Thank you. Allison does have her hand raised. Allison, will you please unmute at this time and ask your question?
Hi, good night, everyone. Thank you so much for taking my call. I wanted to find out, Dr. Beckles or anyone in your group, do you ever do webinars for organizations? And could it be in like a virtual like a WhatsApp grouping? So I'm asking the question for a purpose because I am a 14, almost 15-year breast cancer survivor, and I have a cancer support group for men and women, and I like to bring really vital information to them. But some of them are still sick right now, going through chemo radiation, and they don't really want to come out in person. So I have a WhatsApp group that I invite people to come on and speak with them to give them information. So I wanted to know who's the best person to speak to if for that to happen.
We have an email right here on the screen. You can email us and give us your contact information. Next month is going to be Cancer Awareness Month, and we will be hitting that up real hard on cancers and what to do, what not to do, what foods to eat, how to screen. We will have information on, you can download from every decade of life, what screening tests you should be getting, from breast exams, in your 20s, all the way to, colonoscopies and CAT scans. People need to be checking off those boxes. What decade of life I'm in, I need to get this test done. It's that simple, right? And so when you skip that, that's why you're, they're in this, problem now that they have the cancer that's detected and need chemotherapy. This is all preventable, 80% preventable. And now there are blood tests that can actually detect cancer early. I'm actually going to get one of those this weekend. You can detect 100 different cancers in a blood test. That's the technology we have today, right? Guidry test, look it up. Okay.
Okay, thank you very much.
You're
I could
welcome.
just add to that. Allison, I'm not sure if you're aware, but this is virtual, and it is an effort to really provide useful, actionable information. So every month we have this forum, this series, and our hopes is to work with individuals like yourself who are involved with groups that would come on, even co-sponsor by sharing this information with your group so they could be a part of this effort. So I can reach out to you, or you could reach out to the email address, and we can follow up. And when we send the flyer out, we can share that with you. If you have a group, we can talk about how best to invite them and have them be a part of this or a co-sponsor of it. The idea is really to grow and share this opportunity.
Okay, so I thank you so much. I'm interested. I thank Michael for inviting me. And once I get all the information, I will post it on my group. My group's name is Angels of Hope. I am also a new nonprofit. I have a new nonprofit organization. I've been doing the work for some years now, and my nonprofit is We Fight Cancer Together, Inc. I also know, I've met Assemblywoman Sylvina Brooks a couple of times. I'm good friends with Assembly Member Khalil Anderson and his Chief of Staffs, Monet Schultz, and they. So I've met you a couple of times. So I just wanted to thank you guys for this. This is really, really amazing. Thanks.
Thank you, Allison. I look forward to your email.
Thank you.
You're welcome. We have another question in the chat from Karen that says, once you're on blood pressure medication, can you ever get off? With healthy eating, with weight loss, more than 50 pounds, and daily exercise. So can you ever get off once you start?
Absolutely. The answer is yes. I mean, 40%, you could lose, 40% of people could get their blood pressure under control with just a small amount of weight loss. Just 10 pounds of weight loss can get you 10 to 20 points off your blood pressure, and that's usually all you need to really get off some pills. So the answer is yes. In fact, there's a new field of medicine called functional medicine, where that's all they do is work with you to get you off your metoprolol, to get you off your calcium channel blocker, each of them one by one. I have patients that are off all their medication. Now, you don't just go stop it by yourself. This have to be done in a very controlled manner. And again, close follow-up. If that's what you want, that can be done. Absolutely, the answer is yes.
Very good. Thank you. I do believe Karen has a follow-up question as her hand is up. Karen, can you please unmute for us?
Yes, can you hear me?
Yes.
Great, thank you. I appreciate all the information. So thank you for answering that question. I guess the subset to that is, if you have a doctor that you've had for a number of years that tells you you're never going to get off the medication that you're on, is that when you start looking for a new doctor?
That's what I say on every chat. Look for a new doctor. Very simple.
Yeah. That's just poor advice. Golly, he has no faith in you, and that's just not okay.
Unfortunately, that's part of the problem. That's why you have to be an advocate in your care. People are getting off medications. People are getting off their insulin. People are getting off, cholesterol meds. People are fixing all their numbers, risk factors. He need to work with you to fix all your risk factors. We have the technology today to fix all your risk factors, all of them.
So over the last 7 years, I've lost over 100 pounds. My AC number came all the way down. I exercise every single day.
Congratulations.
1,000 steps. And I don't do it because I wanted to do it. I do it because 7 years ago, my mom died from complications from diabetes. And the same doctor said to me, choose live or die. So that's when I made the choice. And I guess last year when I was looking to get off medication, and he said, sorry, although you've lost all this weight and you're still exercising and your AC numbers are down and your cholesterol is good, but you're never going to get off this medication, it kind of deflated me.
Right. So like I said, look up functional medicine, look for a doctor near you. They have a website where you can connect with a functional medicine doctor. That is their role, is to reverse these risk factors and get you off these medications. There's a regimen and a protocol that they follow for each of the different risk factors. And it's actually outstanding, the job that they do.
Thank you. I will definitely look into that. Thank you again for tonight.
You're welcome.
Thank you for your question, Karen, and good luck. More than anything else, good luck. There's another question in the chat, and the question is from Dr. Yonika, and she would like to know, is kosher salt the best to use?
It's a very good question. So I usually have a slide here with all the different, color salts. There's pink salt, red salt, orange salt, yellow salt. It's all sodium, right? So the salt itself is like this brand name, whatever, kosher salt, all these different things. But in the end, as you know, in chemistry, sodium chloride is sodium chloride. So the sodium content is pretty much the same in all the different salts. What make them, a different color or a different name is just that they may have minerals in them, or where they actually, get the salt from, right? Which water they get them from, etc. But in the end, don't get faked out. All the salts are the same. Taking kosher salt, sure, it's more healthier than just a regular salt without some minerals, some extra, magnesium or manganese or even selenium in there. That's fine, but it's still sodium. It's still sodium. You still have to honor the 1 teaspoon.
Okay. Thank you. Great question.
You're welcome.
I have a few more questions in the chat, but I do want to circle back to Karen as she's looking for a new provider. I think one of the questions that popped up for me when I was thinking about this was, how long would you recommend for a patient or a person to monitor their blood pressure at home to accurately gauge what their blood pressure is? Because I'm sure as she goes to the, doctor, and a doctor that apparently has very little faith in her, her blood pressure spikes. So that's the reading she's basing things off of. But now as she's going to present, to a new provider, what would you recommend, Like how long in terms of duration of monitoring at home on your own?
Right. So, very important question. And so, I mean, all over the American Heart Association website, because people have been asking this question, how do I measure my blood pressure? And so there are a lot of videos on it. There are a lot of government sites on it. I'm surprised to see so many videos on it that you have to sit in a certain, position. You have to relax. Your foot have to be in a certain stance. So all of these things before you take your blood pressure. And you can measure your blood pressure 2-3 times, but in one sitting. And then you could write down the average. But then you do it 2-3 times a day. What you would find is that when you do it 2-3 times a day, if your range is in the 120s and you go up to 130s, and you do that 2-3 days, a week, and you're always getting the same thing, then that's your range, right? If your range is in the 150s and you keep doing it and you keep getting the 150s and you get 160, then listen, it's in a high range here, guys. This is something that needs to be addressed. So the more often you do it is the more values you will have. But you write it down and take it and show it to your new provider so that he can see where you are. Are you fluctuating a lot? Are you consistent? So everybody's different. And so now there's an Apple Watch. I think I actually had the picture there. There's an Apple Watch that came out that measures your blood pressure continuously. And you can actually forward that to your doctor. Okay. So that's the technology. Like I said, today we're living in a different time where we have the technology to record everything. Wearables, right? You have diabetes monitor that you stick behind your arm. You have these watches that can monitor. You can monitor your steps, and blood work will just tell you what your cholesterol is. Start with ABCs. Very simple. Get to know what your A1C is, get to know what your blood pressure is, but buy that blood pressure machine. This talk is on blood pressure because for $40, doesn't matter what make or brand, $40-$50. If you want, we do it to make toast. We do it for simple things in the house. This is something that's really gonna prevent you from ending up in emergency room. If you find out you have higher blood pressure and it's escalating and you can do something about it, it's preventable. Take action now.
Very good. Thank you. All right. Another question in the chat from Willie Dell. How do you control low blood pressure?
So low blood pressure, some people do have low blood pressure, and that means something less than, that top number I showed you where we're talking about 120. And so if you have low blood pressure, that's something that you still have to get worked up by your doctor. So your doctor is going to work you up and get some lab values, get some hormones level, make sure your thyroid is working well. So this has to go through a whole workup, just like high blood pressure have to go through a whole workup. So you have to do this with your doctor together and be a partner in your care. All right. So then make sure you don't have any of those abnormalities before proceeding with anything else. Some people just live with a low blood pressure all their life. And that's a good problem to have, not a bad one.
Okay, thank you for that response. Another question comes from Stephen. How do you increase your LDL?
So when we look at cholesterol, we have different parts that we look at. And so there's HDL and there's LDL. The HDL, we want to keep it high. Okay, so the HDL, we want to keep it high. So just remember that you want it to be 60 and above, right? 40 to 60 for males, as I highlighted it. LDL is the bad one. You want to get that low as possible. Low, L for low, keep it low, right? So those are the two triglycerides that we look at when you go to get your lipid profile done. And you're going to see that. So what you want to get is your HDL up and your LDL low. So again, maybe confusing. They made it that way, but that's just facts. That's just the molecules inside when we're talking about cholesterol and putting that plaque on there on those vessels. So you want to get LDL low and HDL high. Now, diet is the number one way, right? Diet is the number one way. Eating omegas, fish, just like I showed you with the Mediterranean diet, cut back on processed foods, anything that causes inflammation, eat fruits and vegetables. If you're doing all that, yes, you can start some statins. If the cholesterol is really high, if the LDL is high, if your cholesterol is more than 200, you should start some sort of statins until your lifestyle kicks in, until you find out what fruits and vegetables you like, until you find out nuts and seeds, until you find out the fish that works for you, all that stuff. Nothing happened overnight. This is years and years and years and decades of build up, but you want to start fixing it now and start reversing it so that it doesn't form calcifications and problems later on.
Thank you for that. So perhaps the question should have been, how do you decrease your LDL? Thank you.
Yes.
Stephen would like to know, who should get a calcium score?
That's a good question. All my friends got one already. I have people working with me getting one, right? And what's the answer? You know, you have to talk to your doctor, right? And so I'm working with someone and their father had open heart surgery at a young age, at age 40 or 50. So people who have what we call premature heart disease in their family, that means a heart attack before age 50, that's not normal. And so those people have a genetic predisposition, and those people should be screened. Their family members should be screened to get a calcium score. Calcium score is as low as $75 for a calcium score. So it's really, a game changer, in healthcare. Most primary cares, doctors will order a calcium score for you. If you're a diabetic, if you have high blood pressure, your cholesterol, if you have the ABCs, all three, they're going to order one for you to see if you're high risk. Again, it's a screening test. People get a calcium score if they have chest discomfort and trying to figure out, is it indigestion or is it really heart disease? Which one is it? Where are we going with this? You get a calcium score, it's negative, it's 0. High probability it's not heart attack that you're having. It's something else. Okay. So risk factors, people are getting the test on their own. They're just going and just getting it for the price of a dinner. Okay, let's say a Valentine's dinner. For the price of a Valentine's dinner, they can find out how their heart's doing, how their own heart is doing.
Thank you. Thank you. Allison had a question about Himalayan salt, but I think we answered that one with the different types of salts.
Same sodium chloride.
Okay. We have another question from Bernadette. She would like to know, how efficient are those blood pressure machines? I measure my pressure. It reads 126. After 10 minutes, I take it again. It's about 189. I'm confused.
Get a new machine, right? All right. So there's consumer reports. There is, when I went on there, you just ask, what is the best blood pressure, machine. That's why we have all these consumer advocates. They basically list the 10 top, machines, out there, and they put the prices and everything out there for you. Just go to a reputable source online. I don't sell blood pressure machines. Maybe I should. And so just look for one that's reasonably priced and one that has a reputation of, of course, 4-star or 5-star rating. If you get one over the counter in a supermarket or something like that for like $20, it's really what you pay for. What you should do is take your blood pressure machine with you to the doctor's office. And when they're measuring your blood pressure there while you're waiting in the office, after they measure your pressure, then you then calibrate your machine with their machine and see what the number is at that time, and make sure it actually is similar to what their numbers are giving. How does that sound?
Very good. Thank you. Okay, we have one last question in the chat, and this one is from Stephen. My name is Stephen. Hello. I would like to ask, dietary supplements like beetroot and garlic pills, along with special teas like hibiscus, do these items assist in lowering blood pressure?
Absolutely. I mean, that's we are all into herbs and sorrel and everything else. I mean, but if your blood pressure is high, meaning more than 130 and above, if you try those things and you're doing it consistently, the question is, are you doing it every single day? Chances are you're not eating beet every day. Hopefully, and that's the problem. That's where we get into the problem, right? Who's going to eat beet every single day, right? And so you have to know if you're consistently doing it, and simply check it. If you have a blood pressure machine, just check yourself and see how you're doing. Do it for 1 week and see what happens. If it comes down in 1 week, hey, hooray, that's great. What if it doesn't come down in 1 week? What if beet just doesn't do it? What if these herbs don't do it? That's why you need to check yourself. Check many times. Check your blood pressure as many times as you need to. You do your own experiment. You know your body more than anybody else. I don't know you more than you know you. So you got to know your own body. Get a machine that can tell you about your body, and then go from there. If what you're taking helps it, if you take some tea and it helps your blood pressure, then hooray, you don't need any medication. But if your blood pressure still stays elevated, sometimes, like I said, you have to take blood pressure medication until you figure out what food you're going to consistently eat. As long as your blood pressure stays in the normal range, that's all we care about. And look up functional doctors near you and find a functional doctor that they don't do medications. They do functional stuff, which is functional foods, which is what you're talking about, is a functional food that will do the same job, have the same medicinal capacity to do the therapeutics as medications. So that's what a functional doctor is. Look them up. They're everywhere.
Thank you. One last question that jumped in the chat. And this one is from, I may chop your name up a little bit here. Dikia. This particular question has to do with, let's see, cancer treatment. So I finished chemo in September. I had a chest CT in December prior to starting radiation. One of the findings stated small anterior pericardial effusion, possibly, hang on, chat's moving a little bit, possibly radiation related. The cardiologist stated he wasn't concerned because my initial echo was fine. Even after I told him I've been experiencing shortness of breath, I also have asthma. Should that finding actually be of concern? So going back to the small anterior pericardial effusion.
Right. So yeah, so I mean, this webinar is not to give medical advice, and that was in my disclosure. We can give advice, but you still have to be supervised by a doctor that knows your whole picture, your whole chart. Obviously, if you had chemotherapy, if you have radiation therapy, you have a cancer, you're under the care of board certified doctors that are boarded in the state of New York. And so, you have to go along with their advice. Having fluid around the heart is not uncommon, but it has to be something that is watched, because if it increases in size, again, I always say you have to follow up. I need 2 points in time. If I have 1 point in time that tells me it's small, how do I know, unless I have a second point in time, is it getting better or is it getting worse? So I need to repeat the study. So you need to tell your doctor, we are not psychics, apparently. And so you need to tell your doctor, hey, I'm short of breath. I'm not feeling good. I don't think this is asthma. Could I get another echo repeated? Supposing you repeat, another echocardiogram and it shows that the fluid is gone. If the fluid is gone, then your shortness of breath is not from the fluid anymore, right? So then your shortness of breath may be from asthma or something else. So that's how we analyze patient studies, and we repeat studies to have different points in time to determine what to do next. Supposing you repeat the study and it's worse amount of fluid around your heart, then that's a problem, right? So that's what you need to discuss with your doctor. If you're having problems, remember, I always tell my patients, I'm not psychic. You have to call me. Here's my cell number. Give me a call. If there's nothing I can't fix, but I need to know about it. So you have to call your doctor and let him know what's going on.
Thank you for your question. I'm going to call you Miss Armstrong so I don't butcher your first name anymore.
That's fine. It's Dikia.
Thank you, Dikia. I appreciate you. Okay, Alfred Osborne has his hand raised. Yes, Alfred.
Yes, I have a question, and Dr. Beckles. First, I must say this presentation was awesome. But I want to know, you mentioned LDL. At what level will you consider one to start taking medication, a statin?
Right. So if you look at the LDL here, right, in terms of numbers, let me just go over that so that everybody, because if you have that question, everybody will have the same question. And so it's part of C on the cholesterol, just to be thorough. And here it is, right? So you can see here, the dangerous is in red, right?
Yes.
So your LDL, you want to keep it under 100. Now, if you have coronary artery disease, if you're diagnosed with a stroke, if you had a heart attack, if you got admitted to the hospital for heart failure, depending on your age, your doctor may say, I want that LDL to be less than 50, right? So again, you have to be under the supervision of a healthcare provider, because these are just guidelines, but we get to tweak these guidelines and customize it for you as an individual. If you're jogging and running marathons and you're healthy and all your numbers are great and you don't have any other risk factors, then under 100 is fine. If you never had a heart attack and you never had a stroke, just keeping it under 100. Now, You start getting at risk when you go from 100 to 159 on the LDL. And of course, when you get to higher than 160, you're in a danger zone. That's when this stuff starts layering on the vessels and getting plaque accumulate over time, and you're heading into a stroke, right, and a heart attack without knowing it. So these numbers count, and you can take a picture of this on the screen so you can keep it on your phone.
Great. Thank you. Thank you.
You're welcome.
Thank you for your question. I appreciate it.
Now, hopefully
right.
these slides are available, right? So people, the video should be available on the same link, I believe, on the Cassoni website, so people can still come back to these slides if they need to reference it.
Thank you. I think that's the last of the questions, last of the hand raises. We appreciate everyone for staying on the call tonight and asking some really amazing questions, as it really contributes to a healthy discussion. So oftentimes when you have a question, someone else is thinking it, they may not ask it, but you know, it's always good to ask your questions, especially when you have Dr. Beckles live and in person here with us. That's wonderful. Again, I will reference the email address. I think we dropped it in the chat earlier. I check those often, so we get back to anyone who has a question or inquiry for us, okay? And if we can't answer the questions, we'll put you in touch with someone who can, and we look forward to any collaborations that may come down the line as well.
Next month is Cancer Month. Invite any friends that had cancer, either current, present, or want to prevent it.
Absolutely, and that'll be an amazing talk as well. Mr. Davis, any questions before I wrap things up tonight? Okay, he may not be on the call.
No, I am, but nothing for me. Fantastic job.
Very good. Oh, thank you so much. Actually, Dr. Beckles, I do have one question for you. And what is the name of the 100 cancer screening test you mentioned earlier, for those that may be interested?
Galleri test. Galleri test. It's available. Galleri. Galleri.
Okay.
Galleri test. It's already approved. It's already rolled out. You can get it. You can ask your doctor to prescribe it and get the blood test done. And it works with PCR. Again, we have the technology to pick up cancer so early, but you need to be under counseling. Supposing you find out that, okay, I'm going to get, let's say, colon cancer, but I'm only 40 years old, but I don't have it. My colonoscopy is negative, for instance. But that means you need to go for your screening, because it says you're going to get it. And so that's what I mean.
Oh, wow.
Genetics, the genetics tells you that you're going to get the cancer. Doesn't mean to say you're going to get it if you do the screening. So you have to accompany it with screening. It's the same thing like if you go and get tested for the Alzheimer's gene. Oh, I'm going to get Alzheimer's. Oh my gosh, you know. But you have to go and now follow up to do the things to prevent Alzheimer's from happening in the first place, which is, again, comes down to what we eat and how we live and how much sleep we get. So stay tuned. We're going to talk about that this year, 2026.
I love it. So it's like a genetic predisposition test.
It's the genetic predisposition test, but it's real. It's your genes telling you what it has in store for you.
Wow. Wow. Thank you so very much. All right. Well, if those are all the questions, if no one has any more questions for us, I'll go ahead and wrap up by saying thank you.
I have one question.
Okay. We have a question.
Beckles mentioned about the functional doctors or physicians. What doctor do you have to look for? Your PCP or internist?
The functional doctors are basically the functional medicine. If you just go into any search engine and just put functional medicine nearby, you will find a list of them and go to one close to you. If they say that you need to get a referral from your primary care, then that's fine. But I don't think they need a referral from a primary care. You could walk in and see them, ask them how much they charge, and go see them.
Does that answer your question, Sharon?
Sharon, did you hear that?
Yes, I heard you. But you
excellent.
said I just go to anyone, just like a primary care doctor?
You can go to your primary care doctor, but if you want a functional doctor, you can look them up.
I was looking at it and I just saw it has a different primary care doctors, or they have
most of them. So that's a very good point. A lot of primary care doctors I could become a functional doctor. I just have to take a certified course and I become a functional doctor, right? And I have all the programs to give you to get off your medications. So your primary care doctor could be a functional doctor. So that's what I mean. You could look for them. And yes, some of them are functional doctors. They may not be an MD. They could be a physician assistant. They could be
Yeah, I see that too.
a nurse practitioner. Anybody could sign up for them. And so they're there to help you to be healthier, using all natural methods.
Okay. Thank you so much. Appreciate
You're
that.
welcome.
Okay. All right. Hopefully that answered your question, Sharon.
Yes, it did. Yes, I got the answer to my question. Thank you.
Very good. Thanks everyone so much for joining us tonight. Special thank you to Dr. Beckles, per usual, for such an informative and thought-provoking presentation. I know I appreciate it. I learned so much each month on these calls. We truly appreciate your time and the valuable information you shared with us tonight. Again, thank you everybody who joined us, who stayed on the call with us, who asked some amazing questions. At this time, I would certainly like to wrap things up. If no one has any additional questions, you know how to get in touch with us. Again, in closing, over the next few months, we're going to be touching on various other important health topics, and we look forward to hearing from you. Hopefully you guys are leaving inspired and continue to prioritize your health and wellness, and hopefully make it a point to share this series with others, as it may be helpful to, more people than you know. Okay.
I'd like to thank our sponsor for sponsoring this episode, and welcome any more sponsors that want to see episodes like this continue in their communities, and for being passionate about, health and disparity in care.
Absolutely. Thank you, Sylvina, for everything. And thank you, everyone. Everyone have a wonderful night. Thank you.
Do the same. Thank you for your education.
You're welcome. Happy Valentine's Day.
Thank you so much. Good night.
Take care of your heart.
Yeah.
All right.
Happy
Happy
low
Valentine's
sodium.
Day.
Happy low sodium Valentine's Day, all. Take care. I see my mom on the call with us tonight.
That's awesome.
Yeah.
Who's on now?
We're waiting for a few to leave the session. I see 5 on the session.
It probably is. That's probably me twice. Benga, you, and Dr. Beckles.
You're on twice.
Yeah.
Okay. Very good.
Benga.
Dr. Beckles.
Trying to see.
I'm here.
Dr. Beckles just disappeared.
We have Horace Davis twice.
Huh?
We have you on twice.
Yeah.
Yeah.
I had to
Okay.
jump out. So I don't know how I'm doing this with the I think that should be it. What's that?
I think everybody got access eventually. I sent out access to everyone who I invited in all the chats. So they were able to use the same link as I had that you sent to me last minute.
It looked from my emails that the notifications were going out because as it went to them, I was getting emails also. So anyone who was signing in, it was functioning the way it was intended to, automatically sending the notification because I had email notifications from them.
So what I'm going to tell them is, they should RSVP or register by, Wednesday or Monday or as soon as possible, so that they can get it done. But, Caribbean people last minute.
Yeah.
So the issue was trying to register today. Was that it?
Yeah, I think so.
No, I'm not sure if that was the full issue. I think what happened was in trying to correct the originally when the flyer was sent out, somehow when you were registering for the previous and it had the 8th on it. So anyone who had registered before then, an email was sent out to them to correct the registration date and send them the right information for the 12th. But it seems as if we were doing that manually because we had some issues. And I think that was sort of what led to us having a bit of an issue. So now, because it's manual, people coming in at the last minute, it's not set up to automatically go to them. So we had to change that. But hopefully, I think we have everything now and should be set for the next one. We'll make sure that that's the case.
Very good.
Excellent.
Well, our numbers look good tonight. I think partly because we did have a sponsor. What do you
Yeah.
think?
I think it helps. It helps to have a sponsor for sure.
I think it helps. I think it's going to help even more if we get some more sponsors. I got a couple people, but I wasn't able to, it was late and I wasn't able to turn it around in terms of the getting their information on the flyer. And then I was questioning how to handle something. And I need to talk to the councilwoman's office because once I got her to sponsor, then I felt I didn't want to seem as if I'm doing a bit of a bait and switch, get her to sponsor, and then we're adding someone else. Now, my idea from before was that we would just redo the flyer, add a logo, get another co-sponsor. But once we have someone like an elected official or someone that we're working with, I want to figure out how do you do that? Because oftentimes you have flyers, additional people come on and people just add, but I want to make sure that as we're doing it in a way that is most appropriate.
That makes sense. That makes sense.
Okay.
But I got at least, and I'll reach out to Allison. I'm sure if she sends the email, it'll be best to follow up from there. There's another organization, and I think Selvina, her being on, definitely there were people from the district.
Okay.
You heard even Allison mention she knows Selvina, she knows me probably, and so we'll get that to her so that she can be a sponsor. They'll listen to this, hear the information, know that this is quality stuff, and it goes out in her newsletter. And they made copies of the flyer, brought to events with them. So the earlier we get it to them, the better off it's going to be. And we can't do it. That's what I'm realizing. So we have to get these sponsors and other groups like what Allison mentioned, because that's a group that's, focused on health. So, and especially with what's coming up next month, that should be a great topic and subject for them.
Right. The cancers are huge. So, I mean, I think we finished with the sort of metabolic ABC stuff. So that's done now. Now we're going into the cancers, and we're going to get into mental health. We're going to get into, all the different things, the fun things, more fun things.
Get the word out, continue to get the word out. I was able to get in touch with Facebook about trying to promote the post. And at first it got rejected and rejected. And ultimately it came down to, because we had the Selvena on there and there was a tie-in with politics, they do promote things like that, but it has to go through a different route,
Right.
So just saying, hey, boost this post, promote this post, you can't. There's certain categories that if it's touching on certain things, it has to go through a different route to be promoted. So it's
Right.
doable, but we just didn't know how to do it.
I don't know how but it started going through on my end when it was being sent out.
Yeah, but in terms of like paying for promotion,
Okay.
like, $10 or $1 a day promotion equates to an additional, 2,000 people seeing this, webinar post. That had to go through a different, I don't know, route, I guess, I don't know.
Okay.
Yeah, so there was that.
Yeah, these rules are changing every day.
Every
as you can imagine, with social media, politics, Trump.
Yeah.
AI.
On there, it had Black, health promotion for Black folks, God forbid. So
Yeah, he'll come looking for us.
yeah, pretty much. Next thing you know, I don't know.
All going to Jamaica.
But yeah, so this was lovely. I'm glad it went really well. I was concerned at first with the technical issues with the link, but it panned out.
Yeah, I think the people started coming in. And I think maintaining the numbers where we are and keeping with it, eventually, hopefully it'll catch on. But there's a lot to compete with out there.
Right.
Back in the day, if you were going to have an event, you had to pay money, get a space, or have a space. Now it's like every organization will do it virtual.
Yeah.
So
Right.
instead of, coming together, even on the jobs, people are having lunch and learns where they're talking about heart health. They just, so there's a lot out there. I think what we've got to do is just keep doing what we're doing so folks know that what they're getting here is or
quality stuff,
if
right.
not only that it's quality, but instead of doing it yourself and finding someone, and the other thing we may want to think about is, as we hone in on a particular topic, do we bring on someone else that may have a following, can present half as well as the man himself? And
No,
Well, we
absolutely.
already know that's a no, but go on.
I thought we made that clear from the beginning. I'm just kidding. No, I think, listen, I mean, we've only done what, 4 webinars, 3 webinars, 4 webinars. When you're starting something like this that is so, competitive, when you're competing in this space, it's exactly that. It's consistency. We sent off these things. I sent it off last week, then I sent it off again this week. And so you have to remind people. They're all distracted. Everybody's distracted. They have things going on. This is Mardi Gras weekend. People are traveling. Carnival is in the air. It's just people are just distracted, right? Health is not people's priority. That's why they're dying, right? Health is not their priority. It's not number one on anybody's list.
Right.
Unfortunately. And so it's like, that's just the way it is. But these organizations that have people that, that are sick and they have cancer, they have heart disease or they have a stroke and they're trying. So we have to find people that really need to hear things like this, like,
Mhm.
post recuperation after cancer, post recuperation after a heart attack, or post recuperation after a stroke. People don't even know that after a stroke, they have like a 50% chance of having a second stroke, but they don't even know that. They go back
Mhm.
eating the same way, they go back walking the same way, they go back in the same social determinants of health that they started off with, and then have a second stroke and a third
Mhm.
stroke. And then they keep having it. And then they were like, why am I, well, you're doing the same thing. I mean, your closet is, your kitchen cupboard have the same food as it had before the stroke happened.
Mhm.
I
Yeah.
would like to know if it's possible that we could do like a post presentation survey.
Mhm.
Yeah,
If we can get
yeah,
some valuable feedback. Like, is everyone okay
absolutely.
with doing a 30, 40-minute presentation and, reserving the questions to the end? Or do they want more
Right.
breaks where they can
Yeah,
engage more?
we should put that out. Get a survey. You can do that, Horace, or you want me to do that? I mean, they have all these
Yeah.
monkey surveys, monkey, whatever, survey monkey, whatever.
I think that the system that we have is feasible to do a survey on. I don't think Benga is on now, but I can talk to him about that. Do we want to, what questions we would want to do? If we can develop that, I think we could definitely facilitate a survey. We have all the information from people who have registered.
Right.
So that would just be another way potentially to engage them.
Yeah. And I can
Or
imagine with 45 people on the call, or 44, I think at the highest we had 45, including us.
Mhm, mhm,
Um, I do think maybe we can get maybe 3 responses, possibly 4, but
mhm.
if we can get 3 or 4 each month,
No, absolutely.
You're
In
talking
this
about
days,
doing it every month or just doing it now to get a sense of do we
well,
need
every
to
month,
pivot?
because every month we have different participants, right?
Mhm,
So if we can just say, like, maybe at the end of the presentation each month, like, hey, just keep an eye out in your inbox. You might get a short,
mhm,
nobody wants to answer more than, if you're just clicking and choosing something, fine, I'll answer 10
mhm.
questions. If
it
it's a
shouldn't
fill
be
in the
two
blank,
pages. It should be
yeah.
2 pages.
If it's fill in the blank and I got to write, a thesis each time, no.
Mhm.
So, yeah. So
Yeah.
maybe something super short, but that'll give
Mhm.
us valuable feedback. So maybe we can chew over what kind of questions we feel like we can get the most out of these participants with.
Yeah, I mean, if you do that, and then in terms of putting them together and sending them out, we can figure out what the best way to do that is. One concern I would have is moving away from the format of getting through the presentation and questions, especially if it's a hot topic. I think, we've done a lot and maybe we can scale back in things that we might have provided already. But my concern would be Dr. Beckles is providing such great information and we're derailed in getting everything through by questions instead of
You're talking
going through
about,
the whole. What's that?
yeah, but you're talking about putting questions on the chat right after the talk. Like, everybody was on the talk. You have to, like, tell them get off. I mean, they could stay back and answer the survey.
No, 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 no.
Oh,
One of the things that Ruby mentioned was considering getting feedback from folks. Do you want to ask questions or do you want to wait until after the presentation? That
okay.
is the concern that I'm saying. That's not an option
Mm.
for me because my concern would be, the questions that could come in and derail the presentation and the flow.
I get it.
Um, yeah,
Yeah.
I like the way it's done before. Maybe we could with it, because I think before we might have been concerned about are we going to get questions? Now that we see that we're getting questions, this went on till what, 8, after 8 with the questions. We can maybe even make some more time for that. But the presentation, getting through the presentation for something like this, especially how it's laid out, I think is the model that we want to have for now.
Okay. Yeah. I mean, again, we don't have to incorporate everything, but we could cast a wide net, you
Yep.
know, and just
No.
see what all the feedback is. Okay, well.
All right.
Oh, Horace, we have to take our photo.
Oh, okay. Let
What?
me see.
You're gonna appear twice? Are you gonna appear twice?
Right.
Hold on.
You know, he
let me
got to
see.
outdo everybody else. He got to be on there
I
twice.
don't know. I gotta. Where am I now?
Where are you now? There you go.
I gotta get off. Let me see. Hold on. Hold on. Where is that?
Are you driving?
Yes, I am.
Okay,
Hold on.
well,
Hold on. Are you able to see me now? Hold on. Let me put on.
nope.
There we go. Yay.
Oh, that's bad. That's the best I can do.
That's what we're gonna go with. Okay. All right, 3, 2, 1. I got it.
Oh boy. I have no shame.
Look, me and Dan
Yes.
halfway decent, so
Yeah, I had a little one getting her hair done, and I had to run and pick her up. So
okay.
I should have put, you know what, with her hair done, I should have gotten her to take the picture.
Oh, she's a cutie pie. But she looks amazing.
Yeah,
Nice.
so
Let's
that
put
is
picture
the
together. So I'm gonna go.
Okay. All right, everyone.
Dan, it's good talking to you.
All right. Hey,
Same
that was a
here.
great presentation again.
Yes,
Knocked it out the park once again.
Yay!
All
Try to
right.
get it.
For coordinating with Selvina.
Yes. And I think that what we're talking about is she should be pleased with this, and something that
She had all the numbers. She had all the numbers right. You know,
I was very impressed that she was prepared, because her team asked me, what do I want? Do we want her to make opening remarks or anything? I'm like, sure. She can take a couple minutes. So they
I
obviously
thought she was giving the
prepared her
talk.
well.
I thought she was giving the talk.
I was like, whoa.
She had the slide. She just didn't have the slides, but
no, when she started spewing off her numbers, I was like, please let these align with Dr. Beckles' numbers. Like, please.
It was all aligned. It was all aligned.
Good.
Yeah.
That's my concern. I was like, Lord Jesus. Okay.
She is definitely one of our, I enjoy working with her. She's from Jamaica also.
Okay.
And the community that she's in and serves out here is Southeast Queens, as you would know, Dr. Beckles, and very, very significant Caribbean community. And she'll probably be going places.
Good.
She's great to work with.
Okay.
And
She's very passionate.
came on and really prepared.
She's very passionate. She's very passionate about what's going on, and that's all it takes.
So I gotta ask a favor.
What's up?
That picture that we just took, my
he
computer
wasn't
should
okay.
still be on. So,
sir,
you want another one?
Yeah,
There we go.
I am. Oh no!
Your camera ready now?
No, hold on. Yeah, I'm camera ready now. I'm trying to read it. What is?
Tell me when you're ready.
You shut yourself off. He wants the Cassoni background.
I tell you, it's a free promotion here. All right, 3, 2, 1. And I'm going to take one not smiling. No, okay, not like that. Hang on. Very good. Okay, so I will check the email this week, and hopefully Angels of Hope, Angela, hopefully she gets, reaches out about that. That'd be great. That'd be great. And
so Michael, the person she was talking about, Michael, that's my uncle. So he was just calling me to tell me he was telling me about her. She had breast cancer, at a young age and stuff like that. So, and then she opened up this whole company, and she's big advocate. I think he met at the Consular General office in Trinidad, or something like that. So anyway, yeah, great. Again, we're gonna attract some people that really need help and really need that awareness that they didn't know. They didn't know they're supposed to get screened. They didn't know that they can get cancer, and stuff like that. And all these tests are free. They're free. Every insurance, it's just that we're caught up in this rat race, and we don't put priority. Our time is not prioritized for health.
Very,
We
very.
keep putting it off and putting it off and putting it off, and then it never gets done, right?
Yeah.
And
So
I
Then
dropped
I'll
the-
reach out. Well, we'll wait to get the email, but
I'm sure she will email. I'm sure she
that-
will email.
and there's Flowers of Hope out here also. There are a bunch of organizations that may be a way in which we look to grow this. I have a couple interns that's going to be working with me. I might put one specifically on this to kind of see what we can do to build it up and out.
Very good.
Okay.
Good night.
Good
Take
night,
care.
guys. I'll see
All
you guys
right.
in the
Enjoy
morning.
enjoy your Valentine's Day. Enjoy.
All right. Happy
Thank you. You
Valentine's.